Information Center of Delaware, or PIC. I am Kathy Harrell, and I will be facilitating the presentation this evening. For those of you who have joined as attendees, you should see a pretest pop up on your screen. And if you would just take a few seconds to go ahead and complete that before we start, we would really appreciate it. Okay, many of you are aware of PIC, but for those of you who are not, briefly, we are a statewide nonprofit organization, and we've been in existence for about 30 years, or actually over 30 years. And our mission is to advance effective parent engagement in education. So we offer webinars like this to help inform and educate families about issues relevant to their child's education. PIC works to help families become effective advocates and partner with their school teams. Together with outreach to families and advocacy for children and their families on various levels, we also provide individual consultations. We have webinars, workshops, and other learning opportunities for families as well as for professionals. We offer numerous resources through our website, and we also have weekly and monthly e-newsletters that include information, news, resources, and stories. So tonight's presentation is about an important and timely topic called recovery services. The objectives of this webinar are to help define the term recovery services and help to understand it. And also we want to help you to understand the process that schools will use to determine the need for recovery services. And lastly, we want to provide you with information so that you can discuss recovery services with your school team. We are delighted to have the following panelists representing our state for this presentation. Dr. Sarah Celestin from the Red Clay Consolidated School District, Dr. Jeff Conrad from the Cape Henlopen School District, and Dr. Laura Mangus from Milford School District, and Dr. Jill Scannell with the Newark Charter School. Each is extremely knowledgeable and caring about children and families and will help us to understand recovery services. So we're going to start by defining the term recovery services. It is a term used by the Department of Education to describe the special education and related services and supports provided to students with disabilities to address their learning that was impacted by COVID-19. Recovery services provide additional special education and related services to students with disabilities, and they are designed to address the lack of appropriate progress on a student's IEP goals, regression and new issues because of missed or limited special education and related services, again to COVID-19, and then any other reasons as a result of the pandemic. What are recovery services? Again, just to give you a little bit of an idea, recovery services, when it comes to the decisions, they are made by the IEP team. Decisions about recovery services are not the result of dispute, but rather a collective and collaborative response by an IEP team. And how are they going to make that kind of determination? IEP teams will review the IEP and behavior intervention plans if appropriate, and the student's progress on IEP goals. The IEP team will also review documentation showing the degree to which a student participated in remote, hybrid, and in-person learning opportunities during the pandemic. That's what's going to help them to determine the recovery services the student may need. So again, the IEP team is going to consider information including documentation of the degree to which services were offered and access through remote, in-person, and hybrid models, progress or lack of progress made in the general education curriculum and toward their IEP goals. And the IEP team is also going to consider any regression in the student skills and, very importantly, parent input. So at this point, let's allow our panelists to join the conversation by addressing some questions. And if you as audience members have questions, I would suggest that you start to type them into the chat box, and our panelists will be keeping an eye on them throughout this presentation. So the first question, will districts review every IEP to determine if recovery services are needed? And please describe your district's process for evaluating the need for recovery services.
Sure. Thanks, Kathy, and thank you, Parent Information Center of Delaware, for hosting. As Kathy said, this is a really important topic because we know students are having a lot of needs, some that might be directly related to an IEP goal, some that might be a newly emerging need. So I know we're going to touch on both situations, but related to this first question, the process that districts and charter schools use is that as a student, I'm going to kind of talk about it from two standpoints. If your student has returned to school, and then also if your student has remained remote over the last year. So if your student returned to school, so for example, in Red Clay, most of our students returned to school in November of last year. Some of them actually returned to school earlier in October, depending on the program they were in. So as they returned to school, each of those students, we looked at their IEP goals and we collected data over a 6 to 8 week period to really look at, had we seen regression? So let's say, the student, a student has 5 IEP goals. For each of those 5 areas, they would be collecting data to say, okay, do we see that the student has regressed at all from where we expected them to be? So, I'm thinking about a student that I was working with where the student was supposed to be at the level of their 3rd benchmark on their IEP. And so we collected data and we compared that to where the IEP team thought they would be by that time period. And what we saw was for that student, he had 5 goals. In 2 of the areas, he was on track. He was trending with his benchmarks. But for 3 of the goals, he was way behind compared to what the IEP team had thought, where they thought he would be. So in that situation, the IEP team met. They had a revision meeting because his annual was not coming up for another few months. So they had a revision meeting. They looked at those 3 goals where he was behind. And then they discussed the recovery services. And I know we're going to talk more about the process of actually determining how much and all of that. But they looked at the level of needs. So they said, okay, if we thought that he was going to be at this level, but we're seeing that he's actually further behind, maybe he's had regression or maybe he just wasn't making progress during remote learning, then they made a decision that in this case, in this student's case, for 3 out of his 5 goals, they added recovery services in. So that's the process that we use for all students. Now, where it gets tricky is that, I mentioned that most of our students came back in November. And so for those students, we were collecting data in November and December and then holding meetings. But for some of our students, they didn't come back in November. Some of our students stayed remote until 3rd marking period and they came back in February. Some of our students stayed remote all year. So for our students that remained remote, the IEP teams, if possible, depending on the type of IEP goal, they worked on collecting data remotely. For most of the academic goals, that was possible. So they could collect data on reading, math, things like that. For some of the goals, depending on the needs, so students that have maybe a behavior support plan with behavioral goals, or maybe emotional needs with, self-regulation or emotional goals, some of those things were a little bit difficult over remote learning because it might have looked very different in a remote environment than in a school environment. So for students who remained remote, as they've started to come back to school, either in summer or some of the students are coming back this fall, we're going to be looking again and collecting data using that same process that we used last year. So I think the general answer is yes, we look at every student, we are collecting data on each student. Will every single student have a discussion about recovery services? It really depends on that data. It depends on, are we seeing regression issues? Are we seeing that they're behind compared to what we expected? Or for some students, there's newly emerging skill deficits where maybe they weren't having trouble in an area before, but now after remote learning, we're seeing that they're having trouble in an area that we need to discuss. So that's the general process. I know Jeff is going to share more about what they're doing in Cape Henlopen.
Thanks, Sarah. And I also want to echo your comments and thank PIC for inviting us to this discussion about a very, very important topic. And really, we followed some of the same procedures that Sarah outlined in Cape Henlopen. We resumed in-person learning in some form or fashion for roughly 70% of our students on the 16th of September of 2020. Our most complex and intensive students actually attended 5 days a week. But again, the concern was not only for those students who had previously been remote during that mandated period, March through June, the previous spring, but also for that 30% of our students that remained on remote. And really in making, in a lot of what Sarah's already outlined or the procedures we followed, we implemented remote service logs, which became a very, very rich source of information and really helped to inform those discussions as we again considered each and every student in terms of recovery services. Also, in making a determination of need, we also considered some additional factors, and really this relates more to related services, some of those things that were really difficult to replicate in the remote environment. And our concern was really about a lot of our students who did not receive the full amount of related services that were specified in their IEP and in the decision-making that went along with some of those decisions. Really, again, we kind of revisited really the focus and what has already been presented. And I think in one of the first couple of slides, our focus went back to the purpose of recovery services as a kind of a qualitative measure, or a review of progress monitoring, ongoing progress monitoring, and student goal attainment versus a minute-to-minute tally of minutes of services provided or a similar metric. The process is, again, as Kathy mentioned at the outset, very highly individualized, and again depends on each student's progress relative to his or her IEP goals, resulting qualitative deficits, regression, and or the emergence of new skills as a result of lost learning opportunities. So again, I know I've restated some of what Sarah has already stated, but it is highly individualized, and we continue to follow that same process again, and intend to follow that same process this year, that 6 to 8 week period of time where we're taking a look at where students are relative to their IEP goals.
Jeff, I saw that there was a question in chat, and I just wanted to make sure. I think it's a really good question about, is there a specific timeline of when districts and charters review for recovery services and like an end date? So our understanding, and I know we've had many discussions as directors, not just the four of us, but more broadly as a state as directors, is that when the state put out the guidelines about the recovery services, we understand this is going to be an ongoing process. So it wasn't something that was like just for fall of 2020, or just, that there was a deadline of May of 2021. And after that, we're not considering it anymore. We know that, some students have not been able to return back to in-person, and we know that we're going to need to really consider things for them this fall and what that looks like. We have other students. I'm working with a family right now where we considered recovery services in January, and there were some specific challenges with the family. They had several things going on actually connected with COVID. And so we felt that the student needed recovery services, but at that time, the family was very overwhelmed with the idea of adding services. And so we ended up tabling it and saying, okay, we're going to revisit this at the end of the school year and talk about the summer and fall. And so at that point, we actually revisited it in May, and we added services for summer and fall just because of what was going on for that family. So I guess the answer, to Amy's question here from Chad is that there's no timeline from the state that says this is the time period for recovery services, and after that, we're not considering it anymore. So if you have a concern, if your child, is behind on their IEP goals, if you are concerned about needs that they have, that's really something to bring to your IEP team. And we're going to talk later about, like, if you have questions, or maybe you're not in agreement with the IEP team, we'll talk about the process of maybe who to contact if you need more assistance. But there's no, right now at this point, there's no restrictive timeline in the state of like a certain window for recovery services.
Thank you, Sarah, for jumping in and being able to retrieve that question. And so if anyone else has questions, see how quickly they'll get addressed if you put them in the chat. So we'll go ahead to our second question. I think we will. And I think it's also important, just before we answer or start to talk about these questions, this is new, so there will be more information, and most likely this will be an ongoing conversation for some time to come. So we have two questions here. How will recovery services be provided? And can recovery services be provided outside the regular school day?
Thanks, Kathy, and thank you, Parent Information Center of Delaware, for this opportunity. When we look at recovery services, first and foremost, it's an individual student decision. We look at each individual student, and based on a lot of the process that Jeff and Sarah talked about, the IEP team will need to look at the services the student is already receiving and what they're entitled to in their IEP, and then what additional services are needed on top of that to make sure that the student's able to recover things that they have lost or that has been impacted or newly emerging due to the COVID pandemic. Mm-hmm. So as the team is looking at that, they can be very creative in time and in delivery of service, and looking at what setting is the best for the student to receive that, what level of intensity may the student need, and then also looking at time. Is there something within the school day? It's a great place to start, where we can add additional time and services during the day to meet those needs. But then sometimes, depending on a variety of factors, whether it's student stamina or their schedule or just the level of intensity needed, we may need to look outside the school day for things after school, such as tutoring or additional instruction, opportunities to work on organization, for example. And then also that sometimes there could be some places getting creative with Saturday activities. And then of course, over the summer, we've really tried to spend a lot of time working with students, getting prepared for the fall. When we do look at these things, we really want to consider what is best for the students and to partner with the parents and the IEP team to really show that we care. We want to see our students be successful. We want to see whatever impacts have happened because of COVID to be return to the student, that they can continue to gain and make those skills. So we definitely want to work closely with parents and develop the time needed to help their students.
Good evening, everyone. And thanks also for having me, Parent Information Center, and my colleagues this evening. I'm going to echo a lot of what Jill just shared about how the recovery services are going to be provided. I think our teams are really taking recovery services in stride, kind of considering what works during the day versus what could potentially work after school. Using, as Jill said, some guidelines, looking at past progress of our students, looking to see where their needs are now, and definitely not wanting to overwhelm students. Something that we're, trying to keep in mind is, while we have seen definite areas of regression in some, towards some goals, we also want kids to continue to make progress and feel comfortable and reestablish relationships with their teachers and with the teams. So we've been really lucky for a large portion of our students in that they really just had that that immediate shutdown from March until June that Jeff had mentioned earlier. And then we had a lot of our kids back in last summer, as well as this summer. We extended our resources to not just offer to our kids that have 12-month entitlement or identified ESY, but looking for specific objectives that kids may have missed out on that they should have achieved at each grade level. And we offered something called Grade Level Plus. Our teams are now going to be meeting throughout the month of August to look at the progress that, occurred in each building with our kids. And then we will be reconvening our IEP teams where we did not see progress over the summer.
And one more thing I want to echo that Laura said is this is work that we have been doing throughout last school year, immediately wanting to give our students what they need and to make that progress and to have those recovery services. And it will be ongoing, we know, for a while to continually monitor that data and add additional time as needed. And just kind of like what the question in the chat said, teams may have decided to give additional instruction or additional services for a period of time, like, for example, 3 months. And the team may agree that that would have been sufficient time for the student to recover. And if it's not, absolutely reach out to the IEP team, ask for a meeting, ask for a chance to analyze data and look at progress and determine what's the next best steps.
Great, thank you. Any other comments before we move to the next question? This is very informative. I'm trying to very quickly take notes of all of this good information because I know we're going to be receiving phone calls. Okay, next question. How will the IEP teams address newly emerging concerns and needs as a result of COVID-19? So for example, some students are demonstrating social emotional needs that were not previously observed.
Kathy, I'm gonna just jump in for a moment, I guess. And we have spoken, as Sarah mentioned earlier, as statewide directors, as well as in conjunction with the guidance that we received from DOE. And I think we all can concur that the purpose of the IEP team is to address newly emerging concerns anyway. So, if we are meeting as we need to, and we are observing and working closely with our students and families, we're pretty on top of things that we're seeing transpire. And I think we readily recognize that our IEP team is responsible to be aware of all the barriers that students experience in making progress academically and socially and emotionally. And then, we absolutely need to meet and determine those needs and sometimes establish new goals. Something we talked about yesterday a little bit was how very nicely the new MTSS regulations will assist us in the rollout for our teachers, knowing that we are going to have to establish through regulation baseline for social emotional needs for all students in the district. So we'll readily be tiering kids, and any student that is already on an IEP that may not have something to support that area of need, I think will come to light very quickly as our building level teams are looking at those needs across the state. And then obviously we'll move to further evaluation, putting additional supports in place, and convening the team as is needed.
I also want to add, as we see students demonstrating some newly emerging needs, whether it be social, emotional, or academic, we have been and still are prepared to immediately provide interventions and supports and collect the data to see what exactly is the area of need, what level of support is needed. So in that proactive approach of being prepared, ready to give the students what they need, but then also collect data to determine, is this an area that's requiring specially designed instruction? And we need to look at IEP goals. Is this something that with these interventions through multi-tiered systems of support, the student is receiving what they need through the support, and that's meeting their needs? But really that proactive approach, especially around social emotional with the school counselor, school psychologist, preparing teachers for classroom-based interventions and supports is really, really important that we're ready on day one and kind of to meet the students' needs. And then from there, really determining based on data, our IEP goals needed, our additional services needed, just to make sure that our students are in a good place, because there's definitely impacts from the COVID, especially around mental health needs and social emotional. So we do know that our students are going to need some extra support in that area.
Thank you. Any other comments from the panelists regarding that question?
Kathy, just one really quick thing. I think Laura had a great point about MTSS. And so just if you're not familiar with that term, that's related to really a tiered support system that's for academics and social emotional needs. So if you're not familiar and you have questions about that, I did put a link in the chat, which has kind of the statewide guidance and information related to MTSS.
Great, thank you for that. And also Parent Information Center on our website, we have information, and I'm sure the Department of Education as well. So always look for other resources. Anyone else on that particular topic?
Kathy, I just wanted to, in a way of, I'm going to echo what's been said by Laura and Jill, but I wanted to reinforce that proactive approach and the fact that, you know, we, in our district, and I know my colleagues had the same, you know, posture with regard to what some have called, and this is an official terminology, the second wave of COVID, many of these mental health issues that we've been so concerned about, as evidenced by an increase in number of children being referred to and young and adolescents being referred to places like Kids Peace for long-term care, Dover Behavioral Health, Sun Behavioral in our area. And, but, you know, education is all about relationships, right? So our staff, and I credit our staff and educators throughout the state of Delaware, I feel throughout this, we're really in touch with their kids and their families, because again, it's all about relationships. And I know I meet with our school psychologists on a biweekly basis, and they were, you know, every session they were saying, you know, kids were calling them up, families were calling them up, requesting help. Kids who had maybe had mild anxiety issues that were exacerbated by closure and remote and lack of contact with peers and their teachers. So, you know, we really have tried to be proactive. We're just, you know, we're taking action, we're gathering data, and we're, you know, we're fortifying our ability to really serve and provide structures and supports for our children when they return. So that's, again, I'm echoing what's already been said, but that proactive approach, we're just not sitting back and waiting.
Right. Thank you. Let's move on to the next question. What if the IEP team is unable to reach agreement on recovery services?
Sure. So, I mean, it may be a situation where, you know, as a parent that you bring this up and the team feels differently, that they feel that recovery services are not needed, or maybe they have not collected data yet and they need time to look at the data. So the first would be a discussion with the team, and, you know, hopefully you have a school administrator that's part of that team. If not, sometimes I know in some districts they use like a designee, like the special ed coordinator. So if you've had a meeting without a building administrator, like a principal or assistant principal, I would really start there and have a discussion saying, you know, we met as an IEP team. You know, I really feel that my child needs some additional services because of what I'm seeing. The team disagreed on that, or maybe even vice versa. And you talk to your principal or assistant principal, because they're going to be able to problem solve and to work with the IEP team. Some of you might have already done that. You might have already talked to your assistant principal and principal, and that's where all of us at the district level are really able to support. So, you know, Jill, Laura, Jeff, and I all work at the, you know, at a leadership level with our either the charter level or at the school district. And so if you're not finding a resolution through your IEP team or through your building administration, that's where it's important to kind of reach out to your district or charter director of special ed or director of special services, depending on, I know everybody has a little bit of a different title. but that person who is your director, or they might have a supervisor under them. I know some people have a supervisor specifically for special education that really is helping to coordinate recovery services. And so you can always feel free at any point to reach out to your district or charter office, because we can assist. So if there's a disagreement with the IEP team, we could talk with the team and figure out, like, have they followed the process? Did they collect data? Have they looked at this? Maybe they did collect data, but there was a disagreement about the amount of services. I know, in my district, we had some situations like that where I'm thinking of an elementary team. They had collected data and they agreed that the student needed recovery services, but the disagreement was about the amount, and it was about how it was going to happen. So in that case, the team felt that they could do it during the school day, and that they had enough time during the day to kind of include it. And the parent felt that that would be overwhelming to their child, and they really were looking for something outside of the school day, like tutoring. And so, I met with the team and we were able to resolve it. We had a conference call with the family. We talked about it. Both the family and the team felt that there was a need for recovery services, but the disagreement was really about the way it was going to be delivered. So we were able to talk about that and reach an agreement. So I would say, after you've talked to your IEP team, you want to start with your building admin, principal, assistant principal. If you're not getting anywhere, you feel like you're not being heard, or there's concerns, go to your district or charter office and, talk to the director or supervisor for special education. They're going to be able to problem solve and work with you through that process. And then, certainly I know that there's a lot of organizations, Parent Information Center of Delaware. I think Heidi's on from Autism Delaware. These organizations also are helping everybody to understand recovery services and the process. So certainly if you feel that you need additional support, we have a lot of terrific family support agencies within the state that can assist you as well.
Thank you, Sarah. And I think you said something really important too about problem solving. So, from a PIC perspective, you know that very often you may run into either some disagreements or some uncertainty with some issues around your child with your IEP team. So a lot of it is about problem solving and going back to that IEP team. And as you mentioned, then maybe taking a few steps further to some other individuals. And I think, Jill, did I interrupt you? I think you might have been wanting to comment. Go right ahead.
Oh, no, I'm good. Actually,
Okay.
I think Sarah really summarized that well, that a process of, we really do want to problem solve with families. If there's concerns that are not happening, are getting met at the building level, we want to work through it, again, being partners together and doing what's best for the children.
Okay. And I'm seeing a question come through that I don't know if it's coming differently than the chat. And I think we have enough time to put it in here. If a student is going to transition to a new school, who is responsible for providing recovery services? And Laura may be answering that. Are you trying to answer that? Okay.
I did just see that pop in, and I don't know that we actually talked through that when we got some guidance from the state, and I'm glad that I have 3 of my fellow directors on with me. I always think meeting student needs are the responsibility of the current district or school where the child is enrolled. So, we would certainly have historical information as an IEP team, as we would with any new child transitioning to our district from another district or placement, to make determinations about progress and, once again, work with the family as with a new student or as with existing students. Our students move between buildings, and, the current team, I feel, always has the responsibility for ensuring that those needs are met. Would everybody agree?
Laura, I totally agree with you. I think it's goes to the current team. So if your child is transitioning this fall, that their new team this fall would really look at it. I will tell you, I did have kind of a unique circumstance with a student with a lot of very intensive needs. And what ended up happening with that student is we started recovery services after school, and then that student transitioned to a new school. And so what we ended up doing is we worked collaboratively with their new district. We finished up the portion that we were doing in the evening, and then that new district actually started, they actually added recovery services that they were working in during the school day. So we actually met together, we handed off our data, like what Laura's saying, we handed off the historical data. We finished up the after school portion that we had committed to with academic tutoring. And then the receiving district and school started recovery services as well, because they could also see the need. So that would be that, that was a particular circumstance where we were already in the middle of providing something. So we worked together and we finished that up and then kind of passed the baton to the new district and school. But in general, I think really it'd be your current IEP team. So if your child's transitioning to a new school, it would be that new IEP team that would be looking at that information.
Very good, thank you. What about transition recovery services for students who are turning or have turned 21?
So I think I'm gonna kick this off and Jeff is gonna help me out here. So this is actually a complicated question to unpack because there's kind of multiple levels to it. So I'm gonna talk about it in general before we get to 21. So, and I know we have a question in chat about a younger student who's 19 or 20. So one of the things that we know was heavily impacted by remote learning was vocational training opportunities. I know in our district, we have a lot of students in 18 to 21 program who normally go out to community-based experiences, job training, job shadowing, and that was really heavily impacted. And so what we did for those students, and so any age, not just 21, but any age where you're looking at those kind of vocational training and transition services, you would want to follow the same process of data collection. So what we did for our students is we looked at their vocational activities and their transition related goals. We collected data, and what we saw is some of our students really had missed out on experiences and they had missed out on opportunities to work on their vocational skills. And so we added in recovery services for that. What that looks like may look kind of very different than what we're talking about earlier with like academic tutoring. So for vocational training experiences, we added some things during the day where students were getting additional, once it was, safe to be able to go out to vocational training opportunities. We had some things during the day where they were going to different community providers. For some of our students that had missed a significant amount of time in vocational training, we actually partnered with an agency to be able to do some vocational job training in the evening. And so that would be a discussion, if you have a child that is high school or 18, 19, 20 that has transition services with vocational training, that would be something you would want to talk about with the IEP team is what did they miss? What experiences did they miss? And what would be opportunities that could be added in for them to recoup and regain some of that vocational training experience? Because I think Jeff mentioned earlier, there's some services that no matter how we tried, it was hard to replicate on remote learning, right? So we could do some things on remote learning around vocational training, but when it comes to actual community-based experience, some of those things couldn't be replicated. So that would be an IEP team discussion about what did your child miss? Where could we plug in additional community-based opportunities, whether it's during the day or in the evening? And so I can tell you, for some of our 19 and 20-year-olds, we actually added additional opportunities this summer because that was a good time for us to be able to add additional vocational training opportunities. Some students are continuing that into the fall. So if you have a student who is, I know this question is kind of geared toward 21, but even if they're younger than 21, you can definitely have that conversation with your team and talk about how do we add in recovery services summer, after school, during the day to get those community-based opportunities. I think Jeff is going to talk a little bit about the House bill and the process for students who are turning 21, or have already turned 21 for the summer.
Sure, thanks, Sarah. And really, the challenges and concerns that Sarah outlined, as well as and what's been really prompted by the question, was the impetus for House Bill 128, which was signed by the governor on June 3rd of this year. And I believe it was first introduced in January of 2021. But again, that concern that the students were not, were missing out on not only vocational opportunities, but self-help, skill development, in other areas as well. And what House Bill 128, what that does is it permits an extension of special education services, special education and related services for students with disabilities who turned 21 during the 2021 school year. And again, that includes not only vocational, as we've discussed, but other services as well. It's important to note, though, that not all students will be in that who are 21 and who turned 21 during this past year will be eligible to receive the services. Again, it's an individual decision, just like we've mentioned throughout, or individualized decision rather. I'm sorry. And the duration and extension for those services, if the student is eligible, will also vary. Some might be extended for 5 months based on their needs, others for 8, and others for the full 12 months. And of course, not of course, but if services are extended, it will necessitate an IEP revision, and it'll need to reflect the specific reasons for the extension or for the continuing services beyond August 31st of this year.
Thank you.
I'll just add one thing, Kathy. So I know a lot is asking about, well, is this opportunity going to be available down the road for like next summer to potentially stay? The House Bill 128 that Jeff is talking about was very specific to students that turned 21 during the 2021 school year. So the way we're addressing those younger students, like 19 and 20-year-olds, is we're really focusing on working in the recovery services during summer and during the school year, because we don't know that bill was very specific just to the students that were turning 21 and that were supposed to exit this August. Who knows what will happen in the future, but that I think all of us are kind of focusing on doing the recovery services for the younger students, because we don't know if that opportunity will be available in the future years.
Right, thank you. And lastly, how can parents learn more about recovery services?
So families, we're encouraging them, of course, to, as we always do, come prepared to ask questions at their student's IEP team meeting. They can certainly ask anyone on their IEP team. I think generally most districts have coordinators or educational diagnosticians that work very closely with families to set up meetings and make sure that when parents request or when the teams are seeing a need on the district side, that we get something scheduled pretty quickly to, have those discussions. They can also reach out to any of their related services providers. So, if they were generally receiving services or they're working closely with one of our school psychologists, a speech pathologist, occupational or physical therapist. And then of course, our district administrators, our building administrators are all available to work with families and the teams to have those discussions. And I guess I'm just going to have to reiterate one more time the message of my colleagues that we're continuing to do that on an individual basis, student by student, looking at where our students are. We do have a much bigger net out there right now. We've done a lot of preparation, as have all the districts around the state, with SEL curriculum and, really preparing to support and offer additional services to all students, and, do what we can to ensure that kids' needs are met, before they're even identified, but also as students have IEPs, making sure that if there is something specially designed that is going to be required for them to continue to make the kind of progress that they were making before the pandemic, we want to ensure that that's in place.
We also want to make sure that parents have other avenues of resources, obviously reaching out to the school district, the charter school, the IEP team. But I know PIC has done a great job of developing very parent-friendly resources. And I think there's things on your website. I know we've done previous panel webinars on this topic. And then the Department of Ed also has put out some really great resources that I think Parent Information Center will link to. And then there's other agencies such as Autism Delaware and various groups that I think parents can reach out to within their parent community as well to feel supported and just ask the questions that they need.
Absolutely. Thank you. Now, I'm not seeing any more questions in the chat. I think we might have covered all of them, but we'll just give a second or two. And while we see if there are any other questions, I definitely would like to take this opportunity to thank all of you for joining us and hope that you have found the presentation informative. I certainly have. And a special thank you to all of the panelists for sharing your time, your knowledge, and expertise with us. This will, I think everyone knows, will most likely be a continuing conversation as we enter the new school year and we learn more. So definitely stay connected with PIC and stay connected with your school districts. So again, a thank you to everyone again. And I'm not seeing any questions. What I would like to ask is the participants who are joining us, you should be seeing a post poll pop up on your screen, and we would ask that you take that. And we'll give that a couple of seconds. But with that, any last comments from any of the panelists? My last comment is just a really genuine, heartfelt thank you, because fortunately, I know all of you and do know that you're very caring and are really trying to help families through this. And you've had a difficult time too. So we thank you.
Thank you, Kathy, for having us.
Thank you. And I think we're going to be done just a few minutes early. People can continue to do the poll. And I will just wish everyone a really nice evening and a very nice summer.
Thank you so much for the opportunity. Take care.
Thank you.
Thank you, Kathy.
Bye-bye.
Thanks,
Take good
everybody.
care.
Thanks.